We now move on to our first panel discussion for this evening, and the topic is transformative power of technology. And the use of technology has grown in importance, particularly throughout these COVID-19 lockdowns, and we've seen it all over the world. As a result of social distancing practices, it has meant that many non-COVID-19 patients could not visit their GPs face-to-face. They had to get diagnosed remotely, and we saw that this was happening with the rise of telemedicine growing strongly over the period. The next panel will be looking at the role of technology more closely in strengthening the healthcare system here in South Africa throughout COVID-19 and of course beyond. Here are the panelists.
Romulan Pillay, Managing Director of Philips South Africa. Andrew Davies, CEO of Synapse. Joel Uporogo, Founder and CEO of Sen Health. Daniel Visser, Managing Director of Healthcare Technologies.
Good evening, gentlemen, and welcome to the Future of Health Summit. Before I begin with my questioning, I was just interested in whether you guys have insights into how South Africa is looking to its future of health based on what the Minister, of course, has said. We have got a bit of insights into how the government is thinking about preparing and strengthening the healthcare system for the future. And Romulan, just to begin with you, any thoughts on what the Minister has said so far?
Yeah, I think it was a clear indication from him that we have to provide better access to care because there is this imbalance. And then another clear focus is on the value-based care and the patient experience, whether you're in private sector or public sector, I think is quite key. And I think he highlighted that definitely organizations like the one I represent as well need to do more to support these objectives that he highlighted.
Certainly, and I'd like to get the insights also of the entrepreneurs there on the panel. I mean, does the thinking and the guidance from the Minister inspire confidence in South Africa's future health care system? Andrew, would you like to kick it off?
Yeah, great to be here, Fifi. Thanks very much for the opportunity. I actually think, when you questioned the Minister on the technology side of things, I think the sort of grip around the strategy or what the strategy should be in respect of technology was pretty clear. Bridging divides, remote access given the shortage of health care workers, the stresses around healthcare workers and the ability to use decision support systems to, alleviate burden, which is a massive issue, a massive, mental strain for these people. The role of telemedicine, I think he, and also interoperability, which I think is a massive issue. I mean, interoperability is a global issue, and certainly, a big issue in South Africa in the context of NHI. I think from what I understood, he's got a pretty clear grip on the issues.
Mm-hmm. Joel, I mean, a general thumbs up so far to the future of health here in South Africa from the first two speakers. Do you share the same sentiments?
Talked about was quite spot on, especially when you talk about things like a digital first approach, which is something that I believe will actually be the big game changer, because without us having data and actually going on the digital first approach, we find it difficult to really achieve most of the things technology can do for us. Secondly, I think we have to look more into the health ecosystem within South Africa. How do we really try and grapple with the interoperability we experience in sharing data and in actually being able to move things forward such that we can develop very viable health interventions, just like what Andrew mentioned. I think he talked about interoperability, so that's quite important. So yes, I do agree with both people.
All right, so that coming out is a key challenge, and I look forward to engaging you a lot further on that and how we overcome it. But just final opening remarks from you, Daniel, just based on what we have heard government say regarding the future of health.
I'm very pleased with what is mentioned there, and for us in the healthcare system, we definitely look forward in taking his hands in moving the systems forward. I think that we've got all the technology required to assist them in the move to achieve these goals, which they are currently facing and the obstacles with that. So very positive about his speech, definitely.
All right, so 4 thumbs up there from the panelists. I wonder if everyone is being overly polite. You can be truthful, of course. I mean, the minister is offline. It doesn't matter what you do say. But nonetheless, that let us move on to unpack the findings, rather, of this year's Future of Health Index. And Romulan, I'm asking you to perhaps kick the discussion off for us in this regard, particularly for people who are joining the summit and are being introduced to the Future of Health Index this year for the first time. Just take us through a better understanding of, what the index is about, how the research was conducted, and more importantly, what the main findings, the salient points regarding technology's role in strengthening the healthcare system here in South Africa.
Thank you, Fifi. Well, firstly, the research is conducted annually by Philips across healthcare professionals. In this year, it had a particular focus on young professionals, so they focus on technology. Now, in terms of the findings clearly demonstrate that we are at a crucial moment in the journey to the future of healthcare. Across the globe, younger healthcare professionals juggle immense responsibility, with long working hours leading to stress and potential burnout. But the report places South Africans at the forefront. 82% reported regularly experiencing work-related stress, the highest across all 15 countries, while 43% considered leaving the profession as a result of work-related stress. There's also other findings that are related to high expectations that the adoption of the right technologies will reduce their stress. And they're excited by the future of medical technologies. On par with the average of those across all countries surveyed, South African healthcare professionals expect that the adoption of digital health technologies will decrease their stress levels. Also, the majority say that advancements in medical technology make them excited about the future of the profession. There's one other finding that I'll elaborate on as well, Fifi. South African healthcare professionals rate technology as highly as work-life balance. Unlike their peers in some of the other countries surveyed, younger South African healthcare professionals rate the latest technology as highly as work-life balance when deciding where to work. This is possibly due to the potential to decrease their workloads and work-related stress.
That is a really interesting finding there from that research. It did stand out to me also, and I look forward to engaging you a lot further. But Andrew, Joel, and Daniel, before I also get into the meat of this discussion with you, perhaps just introduce your companies to us, because you guys have come into the healthcare space to provide solutions to strengthen the system. And just speak to the audience about the problems that your innovations have helped to solve so far, and perhaps also the uptake that you have seen from the public and the private sector. Andrew, beginning with you.
Yeah, great. Thanks, Fifi. I'll actually just take up on the offer to be a little bit more controversial in terms of the minister's earlier statement. Say, and I'll contextualize it in terms of the work that we're starting to do in Europe now. But one of the things that I do think needs a little bit of work from government in the state is looking at procurement systems. We are starting to work with the NHS in England, and I'll go into a little bit more detail of that when I give you some background. But I've been quite fascinated by the procurement structures that they've put in place to create an environment that really fosters a competitive environment for SMEs that are offering technology solutions to really offer those solutions into the NHS. But just to your question, to take a step back, what we've built is a care coordination platform. It's based on a messaging paradigm, very similar to WhatsApp. And really what we've created is a tool for clinicians to coordinate the care of specific patients through conversation, through integrations into existing systems, etc. We've deployed the technology in South Africa into a number of state hospitals, a number of private hospitals, managed care organizations, and administrative schemes. So at the moment, we're sitting at about 4,000 active clinicians that actively use our software in South Africa. And recently we awarded a contract in the United Kingdom to provide our technology to the National Health Service in England. So that's a little bit of background about ourselves.
That's quite an achievement there, really an achievement for a South African company there. Joel, just a bit more insights on Sen Health and what you do, how you are navigating the personal health care space. I do understand that we have lost a bit of connection to Joel, and we'll hopefully try get him back in just a moment. Daniel, perhaps you can then take over and just give us a little bit more color on healthcare technologies and your experience of being an SMME in our healthcare space here in South Africa, your experience working with the public sector and the private sector so far.
All right, so for healthcare technologies, we are SMME. We serve in all 9 provinces of the country, the major pathology groups, the hospitals. We have the likes of Ampath, Pathcare, Lancet as clients, and Netcare, Mediclinic, Life Healthcare, the big hospitals. And I really feel that to make it work in South Africa as a SMME, you have to really drive hard. We holistically look for new technologies around the globe all the time for the proper problem solution for our clients. And I think this is where we have been successful in the case where we have actually acquired PCR technologies, which is actually very active in Europe at this stage. For instance, it's been used like at the VW plants, where they actually do active COVID testing. When anything is serious, they actually implement these systems to avoid any turnover or losses. Further, we always try and exceed in what we can possibly offer the clients in a sense of the equipment, what we have got available, always looking at offering solutions which is a preferable option for the pathologists and the physicians themselves.
All right, so with technology, Romulan, as you did highlight at the top of your answer, young people are really pushing for the adoption or stronger adoption of technologies within the hospitals and the clinics that they are working in. And you did mention the fact that perhaps it is as a result of the fact that technology can reduce the load and certainly lighten the load there on their backs. And I'm just wondering if there are any other reasons that are driving the push amongst young professionals of technology, but more importantly, how that push is being received on the other end.
Yeah, there's definitely this element of a streamlined workload. Now, most young healthcare professionals in South Africa are convinced that technology's potential to reduce their workload. I think that came out quite clearly in the research. But also many see the portability of healthcare data as the top digital health innovation that will improve their workplace satisfaction. If you allow me just to reference some of the data from the survey, 74% of the younger South African healthcare professionals see the implementation of the right technology having the ability to streamline workload. And despite this, they are less likely to feel this way compared to their peers in many of the other countries surveyed, including Australia, Brazil, and India, which was high at 87%. However, it's more than that, Fifi. They also believe that it will improve patient outcomes and experiences. In the Future Health Index of 2019, many healthcare professionals in South Africa acknowledged the importance of patient data to positively impact patient experience. This year's Future Health Index showed that the next generation of South African healthcare professionals continue to appreciate how digital health technologies can play a powerful role in improving the patient care. In fact, young South African healthcare professionals feel hopeful that the adoption of the next generation healthcare technologies can improve the entire healthcare system. Thank you.
Thank you. And of course, feel free also as the audience members to engage in some of the thoughts that have been shared so far. We'd really be interested in hearing some of your experiences, particularly those of you who are operating in the healthcare space. Andrew and Daniel, you guys have, noted or have mentioned the level of interest that a lot of your innovations, your product has received elsewhere in the world. Primarily, it would seem the UK. But I'm just wondering about the level of reception to some of the latest technological innovations here in South Africa, and why it would appear you are not experiencing the same level of uptake so far.
Fifi, yeah, maybe I can jump in here. I think, look, the data that Romulan talked about was really interesting. I mean, I think one of the reasons that there's certainly, our experience amongst the younger clinicians is that they understand the role of technology because, we've grown with them. Talking about myself as young, I probably shouldn't, but we've grown up with, technology. We understand it. We understand that it can contribute toward productivity and efficiencies, etc. But interestingly, one of the reasons that we got into this game is we looked at some of the data coming out of Europe and the US around electronic health records specifically. And there's a very well-known article that I encourage the audience to read called "Why Doctors Hate Their Computers." And it focused specifically on this issue of electronic health record adoption in Europe and the US, which was a bit of a disaster, to be absolutely honest. And I think it's a function of the types of, where these vendors come from and the types of systems that they are developing, which are not necessarily very clinician friendly. And that was really the reason that we got into the game. What we saw was that clinicians were using mainstream communication media, generically available or openly available software as a service tools to actually solve, issues around coordination of care. Obviously, that's an issue in healthcare because you're dealing with highly sensitive data. These systems aren't necessarily integrated into other systems, etc. So I think whilst I can absolutely understand that clinicians are very keen on technology because of their experience of it in their personal lives and in their work lives to some extent. I think that there's also some downside to using technology. And that's really the focus, of our business. We're trying to, build a product that feels familiar, feels intuitive, creates a great user experience to really solve that problem. I mean, in terms of adoption, we've been quite successful with that strategy. I think that the familiarity of a messaging paradigm to coordinate care, because I'm sure every single one of us on the panel here, and probably most of the audience, are familiar with something like WhatsApp. That familiarity of that interface has really been very instrumental in us getting traction in South Africa. And obviously that was an opportunity that the NHS saw in the United Kingdom as well.
Mm-hmm. Daniel, and then if you'd like to add to that also, and if correct me here if I'm wrong, I see your organization actually imports a lot of the equipment, the healthcare medical equipment, and then distributes it widely here in South Africa. So as you add to that, also just maybe a comment on whether there is a local capacity and whether you have seen a ramp up of local capacity, particularly throughout this pandemic, in terms of the innovation and the adoption to local innovations that have taken place so far.
Yes, that's absolutely a very good question. I think most of the highly technologically advanced items always comes from either the EU, the US, or otherwise some of the items comes from China, India, and Australia. But I think that the reality is that we really need to develop our country in a sense where we get the right engineers, we get the right people which can actually tackle these type of situations where we always end up outsourcing a lot of these functionalities. We've got engineers which actually need to go to parts of the EU where they need to get the CE certification because it's so difficult in South Africa to actually access these systems here. In the EU, You'll have your manufacturing plant where you will start to develop your products. Right next door, you will basically have your ISO facilities and your CE facilities, which you can jump in there, you can consult with these guys. And so I think there's major vacuums in South Africa where we can actually develop our country in such a way, and we see money leaving the country because of this. If we can develop this locally, we can obviously keep us here. We are upskilling people, we are making job opportunities for these people. And so yes, we are in a situation where we usually have to import these items. There are some typically more low-key items which we can purchase locally, but these are the fewer of the items. I think when it comes to certain standardizations and certain qualifications, there's definitely much more to choose from overseas. That's it from my side.
Yeah, and that certainly does speak to an area of opportunity that is here in South Africa, but of course it does require the right skills to develop some of these technologies, and also the right environments. And Romulan, let's then continue to unpack maybe some of the challenges that the Future of Health Index does highlight by way of the experience of young professionals in perhaps getting a lot more technology to be adopted in some of their workspaces. One thing that the panel has already highlighted in terms of being a challenge is the interoperability of technology usages. But perhaps as you speak to that point, just what are the other main challenges that are acting as immediate barriers to a more rapid rate of technology?
Thank you, Fifi, and quite correctly, yes, my colleagues highlighted the interoperability as an area when referencing what the minister shared. I'll add one more to that on portability of healthcare data. So let me expound on this a little bit. So the portability of data is still lagging behind, according to the research. And young South African healthcare professionals are more likely than those in many other countries surveyed to say that they have insufficient data to influence outcomes, and to feel that the data they have available does not lead to actionable insights. Some younger South African healthcare professionals also feel that the digital patient data that they have is not relevant. These issues may stem from South Africa being a developing country and still in the early stages of digital patient data adoption cycle. Now, when we speak about interoperability, in the Future Health Index of 2019, the report showed that South African healthcare professionals indicated that a lack of interoperability was a reason for not sharing data inside or outside of their health facilities. This year's study shows that a lack of interoperability continues to create issues for young healthcare professionals in South Africa, acting as a clear barrier to embracing technology at hospital practices. This trails behind budgetary constraints, which came in at 42%, and is on par with bureaucratic processes at 20%, and a lack of understanding of benefit, which surveyed at 19%.
How can this be fixed then? And I'm wondering if Daniel, Andrew, you've got insights into this, as you also highlighted the challenge of interoperability of technology here in our healthcare system. I mean, how do we overcome this barrier, as well as perhaps others, in terms of the lack of insufficient access to data, or perhaps the lack of access to relevant data, and even the budgetary constraints challenge?
If I can jump in here, I'd say the newer systems that we're looking at is absolutely integrated with each other. Data is becoming more accessible all the time. The system's reporting methods is easy to use. It's very clear and decisive on what action to take. And in the future, it will definitely be where we get systems which is interlinked, and it will be stored in such a way that doctors, wherever the patient move, the doctors will be able to access these files, and they will be able to comment on the necessary procedures. They will be able to see a full history of the client, symptoms and issues that they've had in the past. So I can't see that the system is too fragmented. And in a sense, the thing that we really want to see is that there are data centralization when it comes to effective healthcare. And when you start to look at that, then I think you can make the proper diagnosis for a patient when you see his history in a holistic way, and not fragmented from one or two tests. These equipment talk to each other in such a way that it can store that information as required for future use.
All right, Andrew, your thoughts here, and also
Yeah, maybe
whether.
I can.
Yes, please
Maybe
go
I
ahead,
can.
and perhaps also add to, the privacy concerns potentially of this access to the data.
Yeah, so I think, I think Daniel alluded to it, but I think in terms of from it, it's becoming less of a technology problem. Standards like FHIR, the APIs available, the ability to integrate, all of those things are starting to come about. I think that the issue is more of a, and what we refer to in the technology industry as an integration problem. How do you get participants in a fragmented environment to share? So technology and standards are one piece of the puzzle, but the other piece of the puzzle is, what's the incentive to share, and how do we share? So I do think that there's going to be an element of regulation here. So that's the one aspect. The other aspect is the use of innovative technologies. So as an example, there's an organization in the US called Patient Ping, venture capital funded organization. And every healthcare organization, whether it's Medicare, Medicaid, or providers of care across the US, that have this module installed in their infrastructure is able to actually ping whomever requested data about a specific patient. So, we're starting to see some initiatives in South Africa to solve this problem. I think Care Connect, which is a healthcare information exchange, is a very good example of that. But also not to underplay innovation. Like if I look at, a company like Vula, that facilitates the transfer of referral information in South Africa. They're basically facilitating interoperability at the point of handover of care, and that they're doing that peer-to-peer between clinicians. So not everything has to happen between heavyweight systems. Interoperability is something that can happen on the periphery as well. So I'm going to be very interested to see how it plays out. I think it's becoming less of a technology problem and more of an integration problem.
All right, and it would seem that there's quite a lot of a focus on this particular topic, and in fact a further question particularly regarding the privacy and who owns the data. Is it the doctors, the patients, coming through from the audience? And Ramula, I'd just like your views on this, the question of data ownership. Whose hands does it lie in?
Yeah, so at the end of the day, it's the patient's data, right? And I think we have very specific privacy rights in South Africa that govern this, and those apply equally to this. However, where data is being used to help in terms of treating the patient and ensuring a better patient outcome, I think consent can be obtained from the patient for the hospital and the clinician to use this in a better way, in a smarter way, to arrive at a better clinical outcome for the patient.
Daniel, one last thought from you on this before we move into some closing comments.
Very relevant question. So we recently placed a piece of equipment at the pathology group, and there's bi-directional communication on this equipment. And now the first comment is, you can't have any access to our patients' data. And the reality is that we do not want any access to the patient's data. The bidirectional communication is for purposes of ensuring that the equipment is optimally functioning, and So as Romulan said, the patient's data is very strict, and we trust our doctors with our patient's data. And these systems are built in such a way that they should be secure and not be able to, that other people are able to intrude on this specific data. So it is as safe as a file in a cabinet. If somebody breaks in and try and break open the cabinet, yeah, there could be a possible theft of data. Otherwise, patient data always stays secure and private to the patient and the doctor themselves.
All right, good to know. Gentlemen, can we get into some final thoughts and specifically speaking about where you are seeing the greatest opportunities lying for the future of technology in strengthening South Africa's health care space? Andrew, perhaps some comments from you. The greatest opportunities right now that we should be exploiting.
Yeah, I think the minister actually alluded to it. When he spoke about using technology to support frontline workers, I think that's an enormous opportunity. I think some of the points that Daniel and Romulan touched on, and Romulan's or Philips's research touched on around the stresses that healthcare workers face. Shortage of healthcare workers is a global problem. So if we can develop technology that enhances workflow, solves this problem of interoperability and portability of data, which ultimately is for the benefit of the patient. I think, anyone that's been a patient is frustrated by, having to walk into a doctor's environment and, having, let's say, had a referral and been having to explain, exactly everything about your situation all over again. I think that there's enormous opportunities to really empower healthcare workers in South Africa with technology. And I mean, obviously, the goal of any healthcare environment is you want to improve efficiencies, lower costs without compromising quality, or actually improve the quality of healthcare. And that's really where I think that the promise of technology lies.
All right, Daniel, your views on the promise and how to exploit the technology a lot better. What are the opportunities here, the low-hanging fruits, as it were, to really ramp up our healthcare sector and get it fit for purpose?
Well, I think firstly we need to see what the actual problems is at the moment, and if we start to look at that, the role of technology in this era is amazing. I think it makes me really excited. If we look at the problems, it's accessibility, waiting periods, and the costs involved in some of these treatments. And what we want to do is we want to give patients faster, more accurate treatment decisions for the physicians. A lot of medical and diagnostic equipment are expensive, and this leads to these items being centralized in regions with a sustainable amount of work or patients in this case. Firstly, improvements in medical technology will drive down these enormous costs related to the previous generation of equipment. We need to look at equipment that is affordable, accessible, and accurate. The primary objectives is to make these systems user-friendly in a way simple to use, simple to get results. Coupling these principles into a robust system, we can design a system that can be decentralized, making it more accessible. Mm-hmm. Systems that you would be able to take into the heart of Africa and still be confident about its performance. Mm-hmm. I think when we start to look at the processes, what is the main problems for doctors? They're having a hard time getting the required data. We've heard this over and over. What's the frustration for patients? They're having like waiting periods for days sometimes to get the proper results. What's happening with this new generation of technology is that we are basically shortening all these sections. The testing is happening faster, the patients getting the results faster, the doctors getting reports which they can easily analyze, and they can easily give the patient the required medication or whatever is necessary, to better the situation. So I think the ideal would be is that we get to a place where these systems prices get lower, and I see this happening, all around the globe. As technology moves forward, there is an absolute fight for market share, and the prices are being pushed down constantly, and the accessibility to these systems are getting greater and greater. I think sometimes there's underlying problems in the systems that we work in, on an operational side, or on a red tape side, where people are actually limited to what can happen at what stages, and we maybe need to look at the formal structures which there were in the past, and start to move to new spaces where systems can be more easily adopted by, say, the doctor in his office, sometimes. So yeah, that's my way.
Thank you so much. And Romulan, just final thoughts from you. I mean, even as you encapsulate the Future of Health Index, and how you're hoping it does land in the public and the private sector, as well as the greatest opportunities that Philips sees in terms of strengthening the healthcare system here in South Africa as it stands right now.
Yeah, thank you, Fifi. And just outside of the research, I'll initially state that the biggest opportunity for healthcare technology companies is to have a better level of engagement with the public sector and private sector hospitals. You can come to a table where there's better stakeholder engagement between physicians, clinicians, probably involve the chief technology officer as well, and a few other stakeholders, so that jointly you're working towards better health outcomes, better patient experience, a better staff experience, and lowering the cost of care. Now, specific to the research and the opportunities identified, South African professionals clearly focused on AI, or artificial intelligence, or adaptive intelligence, and they believe that AI has the ability to improve patient care in other ways in the future. More than half of younger South African healthcare professionals view being at the forefront of AI in healthcare as important when selecting their place of work. Not only do younger South African healthcare professionals see the value of AI for patient care, but also some believe that using AI to integrate diagnostics and optimize operational efficiencies would be most beneficial in increasing workplace satisfaction. Thank you.
A very interesting insights, and a great place to leave it there. Thanks so much, Romulan. That, of course, was Romulan Pillay, who is the Managing Director of Philips South Africa. We were also joined by Andrew Davis, the CEO of Synapse. Apologies for Joel. We struggled to really get him up on line. Hopefully an engagement with him on another occasion. He is the founder, of course, of Sen Health, and also Daniel Visa, the Managing Director of Healthcare Technologies. Thanks so much, gentlemen.